Hello, Professor Fairley in class. My name is Tiana Isaac, and today I will be doing a presentation on multiple sclerosis. First, I will kind of give you a background on multiple sclerosis. It is a progressive neurodegenerative condition which attacks the body's immune system and nerve system. It is most commonly found in men and women between the ages of 20 to 50 years of age. However, in rare cases, you can find it in elderly and children. This is a silent disease, which means it is no obvious signs of having a disease, what makes it harder to pinpoint where it originated. Symptoms of this disease can range, which can also make it harder to diagnose. Here are some of the genetic factors. Women are 3 times as likely to be diagnosed with MS than men. This is due to the female hormones and amount of vitamin D produced in the female body. Multiple sclerosis affects the myelin gland in the nerve system, making it harder for the nerve system to send signals throughout the brain and other parts of the body. After the myelin gland is worn down, multiple sclerosis attacks the nerve fiber, which overall makes it impossible for the nerve to send signals. Here is what I have basically explained. This is a normal nerve fiber. These 3 chambers you see here are the myelin glands. You see how this is healthy, it's normal, it looks okay. Now here is a nerve fiber that has been diagnosed with multiple sclerosis. You see how all the myelin glands are severed and damaged? This is not good. This is what causes the signals to be malfunction and to not go to the right place. There are multiple symptoms of having this disease. In my own personal experience, my mother has MS, and she has experienced multiple side effects. She has experienced pain such as pains behind the back of the eye. She has even got lesions. She's even have like urinary tract infections, mood swings, slurred speech. Everything can happen with this type of disease. This is why there isn't any main reasons of where the disease has originated, if you get what I'm saying. It could be things such as depression, difficulty swallowing, numbness of the face, cramping, fatigueness, dizziness. That's when my mother has a lot: dizziness and fatigueness, and poor balance. My mother also suffers from blurred vision and blood clots. She often gets blood clots in her eye, which usually goes away after a day or 2, but she usually gets them. Here are some of the treatments that can occur when you have this disease. The main 3 are infusions, orally, or injections. Infusions is when you have a needle placed in your arm and the liquid is infused into the bloodstream. DTMs, disease-modifying therapies, aim to work at the root of multiple sclerosis disease activity. It is important that treatment may also come with risks. With this being said, my mother, she doesn't take any of these. She has a natural remedy. She has a herbal doctor and dietitian that she goes to weekly, that she receives the tea from. She takes the tea. She doesn't believe in taking these medicines because most of the times these medicines can make the situations worse in kind of way. It can cause other cancers. It can cause tumors. It can cause multiple other things that probably will make the situation worse. But it's to each his own. You can do what you would like. My mother doesn't do it, but other people, like her best friend, also has the disease, and she does infusions. It works for her. It's just how your body reacts. It all depends on yourself. The BIPOC person I chose was Dr. Susan Hochfeld. She is from Chicago, Illinois. Whoop, whoop, the hometown. She was born March 24th, 1954. She has received her bachelor's degree from University of Rochester in 1973 and her PhD and Autonomy in Neuroscience from Georgetown University School of Medicine in 1976. She also served as the 16th president of the Massachusetts Institute of Technology. She was the first biologist and woman to serve as the institution's president. She has helped in many cases. I actually have found her help personal to my mother. My mother has been a part as many of the practices in the physician work that she has done. So she is very great at what she does. And even though she doesn't still currently work as a neurologist, I believe the word is, or neuroscientist, she still comes and checks in from time to time to make sure everyone is doing their job correctly. This is the end of my presentation. Thank you.